Good afternoon, everyone. My name is Gaetano Marrone, and I work at the European Center for Disease Prevention and Control as biostatistician. Very welcome to today's talk on the series Modeling Perspective Beyond the Numbers. In this series, we explore how modeling predicts outbreaks, how modeling tracks pathogens and shapes effective intervention. So it's a real pleasure for today that today we will have Adam Kucharski. He's a professor in infectious disease epidemiology and the London School of Hygiene and Tropical Medicine. Adam focuses on making better use of data and analytics for epidemic preparedness and response. Adam writes about science, and many of his articles have appeared in places like Financial Times, New Scientist, Scientific American, The Times, and so on. Apart from many scientific publications, Adam is author of books such as The Rule of Contagion and The Perfect Bet, and the new book, there is a new book, Proofs, The Uncertain Science Certainty, which is out since a few weeks. Apart that, Adam has been he's a TED Senior Fellow. He has spoken on several topics there. And today we will hear him talking about improving analytics and modeling for epidemic preparedness and response. So we would like to have a kind of an informal chat with him, so feel free to ask questions. We will hear him, his talk for about 30 minutes, and I would like to ask you to kind of hold your questions, write down your questions, and then you can ask him your questions afterwards, either by raising your hand, or you might just write in the chat. So we'll give a look to the chat, and we can kind of ask the questions that are in the chat later on. This session will be recorded, so just so you know, it will be also made public. Adam, thank you so much for being here with us today, and please.
Okay, thank you for the invitation to come and speak. So I'll just share my window, and hopefully you can see some slides. Today I wanted to talk a bit about some reflections on the response that we've done to COVID and other pathogens, and then some of the work we've been doing to try and build on that, and then drawing on some case studies more recently where we think there's potential for a lot more benefit. So I think, like many groups, we did a lot of analytics work during COVID, and we found a few of the tools that we were developing, because the code was shared alongside real-time reports, was getting kind of picked up and reused by other organizations. So one example, for instance, we did was some estimation of underreporting. If you think about the cases and the deaths being reported, accounting for delays, that can give you some clues about whether there's not enough cases relative to what you'd expect for the fatality risk, for example. So that was really some early situational awareness, but it got picked up by various newspapers, collaborators in kind of other countries who then would build on the methodology and apply that to different settings. So a lot of value in having these kind of tools out there that people can use, but obviously a lot of bottlenecks to actually being able to do that effectively. I think one of the reflections we had was there's obviously been a lot around things like the 100-day mission for future pandemic threats, and thinking about that early period where we need some acceleration of things like diagnostics, therapeutics, vaccines. But of course, there's also the question, that early period of what are we dealing with? What are we potentially going to do about it? How do those different options trade off? So it kind of brought about these discussions about, well, what about analytics in those early stages? What are the things that we can think about doing more efficiently? And so even if we take, quite a simple task, so something like, what could the final size of an epidemic be? So I'm sure there's plenty of people on the call who played around with models in the past. And one of the nice things about, if you have a simple SIR type model, is if you're just interested in the final size and you're not so curious about the dynamics, you just want to know how big is it going to be in the end, you can do a bit of algebra and get this so-called final size equation. So actually the only thing you need to estimate the final size in an SIR model is the R0 of that particular infection. So the average number of secondary cases early on when everyone's susceptible. But this equation, you can't just solve directly. You need, because the kind of these two Z's of the final size, you need to solve it numerically. So even what feels like quite a simple question, you're going to have to go and do a bit of coding to get this to work. So even just this kind of basic task of you've got a basic reproduction number, you're going to do a bit of work to get this epidemic size. But then thinking about it, you probably want to account for a lot of, say, respiratory pathogens, for some of the heterogeneity in populations, so different age groups mixed with other age groups. And it might be that you don't have a reproduction number to hand nicely kind of ready as a parameter. So you might want to think, okay, I want to get some social mixing data from somewhere and get that formatted in a way that I could think about a final size. I might want to get a reproduction number from the literature, or maybe I've got some data from previous outbreaks and I want to try and estimate what that early growth was like to then use that in some scenarios. So you might have, whether it's line list data or reports, then you've probably got some cleaning steps to do. You want to convert that into some format that you can then do estimation of transmissibility on. To do that, you're going to need some epidemiological parameters, things like the time scale of the epidemic and the serial interval. So what feels like quite a simple question, already you've got quite a lot of steps and quite a lot of things that could be kind of slowing down that analysis. And the way that we've been thinking about this is almost on these two axes that I find useful. So one is along the bottom of how many other people are going to be doing this task in an outbreak. And on the vertical, the predictability, ahead of an outbreak, ahead of a pandemic or an epidemic, how predictable is it that we're going to need to do that particular thing? So there will be some things that are quite hard to predict and quite niche. Not many people are going to need to do them. But in this green space are the things where a lot of other people are going to be doing them. There's going to be a lot of duplication of effort potentially. And if you make a tool that does it better, there's a big audience that can benefit from it. And you've got that predictability that it's going to be something that's going to be helpful and useful. And ideally, we'd spend less time doing the green tasks and much more time actually where we want to be putting our domain expertise, which is in this orange section of things where we do need to tailor knowledge, and it is these kind of unique problems that might come up during an outbreak. So one of the kind of inspirations we had a few years ago was around, for those of you who use R, these toolkits like the Tidyverse, where you have different packages and tools that have been developed, but you have this kind of common philosophy among them. So if you're using one thing in the Tidyverse, you can be confident if you're using something else, it will generally behave nicely and you won't get any unpleasant surprises when you're trying to put together bits of analysis. So along with a number of partners globally, there's a link at the bottom with kind of more of who's involved. We started on what we call the Epiverse initiative. So really the aim was to change from where we were with quite this fragmented ecosystem, some great tools, but maybe ones that don't work nicely with others, or you have collaborations where you have to email the person who develops the thing, and it's actually very hard just to go in and work out to use it yourself, and think, can we support an ecosystem where there's a lot more links made between things? A lot of the tools that might have been quite specific can be opened up a bit more. There's a lot of different ways that people can get involved and benefit from the things that are perhaps already out there, or we can work to fill some of the gaps. So a mix of developing new tools, contributing things that are already working, but then also across the ecosystem, thinking about how can we build out collaboration and opportunities to make use of these things. So maybe just to focus on the new tool development as a starting point, there's a few different things that we've put together, really spanning the kind of trajectory of where you might think of the tasks you do in an epidemic. So even things from early on, thinking about reading in data from different health systems, common cleaning tasks, stability in pipelines, thinking about severity estimation, getting some ideas of under ascertainment, getting parameters from the literature in a format that you can analyze in a nice way, thinking about contact tracing data and over dispersion and super spreading, thinking about some of these small, quite stochastic kind of random outbreaks, perhaps coming up with synthetic data sets that you can test your methods against very efficiently, interpreting serological data and sort of undetected transmission in the past, and then thinking about the final size of epidemics, or wanting to kind of understand the dynamics of these over time. So a whole bunch of tools. I'll talk a bit more about some specific ones in a moment, but also we didn't want these to be in isolation. So in the middle here are some of the R packages that we've been developing, But there's a lot of great tools out there in the wider ecosystem, everything from things to do with social mixing data, estimation of transmissibility, tools for dealing with contacts. Some are just the familiar R tools that you might use just to make your analysis a bit more efficient. Some of the tools like GoData and some of these health information systems, then things with distributions and serology and so on. So we've been making a lot of links with those other tools that if you're familiar with some of those, you can then come in and use some of the things that we're developing and vice versa. So it's not a kind of, you have to be using all of it or none of it. I think a lot of the things that we use them for and others, it might just be using a handful for the specific things that are valuable. So let's go back to that problem I outlined earlier, where we had all these steps that we need to do. And if we think about this kind of toolkit and this ecosystem, there's actually a lot of things now that can help us tackle specific steps here, but then we can also just start to think about how do we link them together more efficiently. So I'll talk about a kind of few components of this this sort of transition across all the tasks you want to do. And I'll start off with this question of, once we get some parameters we want to simulate from, once we get some data on mixing within a population, if we want to simulate an epidemic size, as I mentioned, one method is thinking just about the final size. And this is a package we put together that pulls in data from Social Mixer, which is a very nice package that has there's a big Zenodo community with a lot of the contact survey data. So it pulls it down in a format. You can define the age bands that you want to format it in. And then really with these, 2 or 3 functions, you can get something that allows for variation in susceptibility and interventions around kind of immunization coverage to give you this idea of outbreak size, and there's estimation of reproduction numbers, and you can handle uncertainty. And what's nice is once you've defined some of these contact structures, you can then lift them, if you want to look in a bit more detail, into a package like Epidemics, which allows much more simulation around things like different interventions. You might have some things that target different bits of the contact intensity, if you close schools or workplaces, for example, or you've got vaccination of different groups. You might also have more complexity in that you have multiple populations with some spatial structure and some age structure that you want to link together in some way, perhaps with a gravity model or some mobility structure. And it really just gives a lot of the bookkeeping and the way of kind of organizing what you perhaps just spend a huge amount of time trying to define and make line up in just a very easy way that then makes the call to the model. In this case, this is a pandemic model or a sort of respiratory infection model, but we've got other ones in there too. And what we've done recently is link up, for those of you who might have been using the Odin toolkit, which is a kind of nice domain-specific language that Imperial have been developing, where you can define these models very nicely. It then compiles them to run very efficiently. And then you can do inference and do a whole bunch of other things. But what we've really been trying to do is just make it much easier for users, that if you want to get going with some of these scenario models this afternoon to answer a question, you don't have to spend several days just getting all the pieces together and all the outputs kind of wrangled. It's got a template ready for you to go. And one example last year that some colleagues did a lot of work on was rapid projections of epidemic risk in Gaza, and particularly over the coming months for a whole bunch of pathogens. So there's a lot of combinations of scenarios that needed to be looked at, a lot of different infections, a lot of different estimates to put together, and having tools like Epidemics just allowed those tasks that might have taken weeks to be done in days instead. Another thing that we had during COVID, this is really nice work by Nick Davies, and we're now developing over to be better integrated with some of these models, is interactive dashboards. So at one end, you've got kind of the Odin models where you can go in and develop things yourself. In Epidemics, you've got these more predefined models where it's much quicker to go and pull in the data you need or define the interventions and get them to work in the model. And then we're also getting these to integrate with dashboards like this, where you have kind of JavaScript dashboards that are calling them the models in the background and just allowing a very user-friendly way for some of these specifically defined models to think about different interventions and how they overlap and look at different summary statistics around things like hospitalizations or deaths or so on. So this was a very useful resource during COVID. This is something that Nick's kind of reinvigorating with some of the other toolkits that we've now got available. So really this kind of suite of options for users, but all having the kind of same underlying philosophy of how these things are defined and the data that they're using. So the other thing to talk about, as well as the models, is the parameters we put into these. And I think it's a task that comes up a lot, and it's kind of summed up by this message a collaborator sent me last year. Was surely there's just somewhere where we can get all these in a nice format so we can use these for analysis. I think it's a question that has frustrated us and frustrated many other groups, that there's no just way of getting things neatly. So everyone just goes to the literature or PubMed or systematic reviews and tries to kind of grab these parameters and code them up. And often they're not reported in a way that's exactly what you want. You know, there might be a mean and you want the distribution. So one thing that a few colleagues have been doing nice work on is Epiparameter, which is an R package that has a lot of functionality for, you know, converting summary statistics, having nice ways of defining these parameter objects so you can use them as distributions. You have all the citation data and all the key bits of information just attached to that. So once you've defined that object, you can use it across a whole bunch of different packages in a way that's consistent, avoids you having to kind of hard code lots of numbers in all your code base, which obviously if something updates, you might be in trouble if you haven't updated that particular number. We started including some example parameters in here, but realized that actually there's a much bigger set of efforts that we started linking up with. So one is some really nice work that's been going on with Ancora and others at Imperial, where they've been doing systematic reviews for priority pathogens. They've had a whole bunch of nice papers out, and this Epi-Review R package that essentially is a database for what was in their systematic reviews kind of as is. So we sort of see it as Epi-Review is just what's in the literature. Epiparameter, which we've got, allows you to take that and put it in a format you can use easily in your analysis. There's also these wider efforts with the WHO Hub, and this will be launching, I think the early version of this will be launching over summer, and then the full version later in the year. This repository where it wouldn't just be us storing the parameters, it would be opportunities for groups to contribute. And we're really hoping that it will become a bit more of a standard, that if papers estimate parameters, it will become natural just to put them in a repository that others can easily get them and reuse them, and hopefully increase the kind of prominence and attention given to the work that people are already doing to estimate things. Again, going back to this pipeline, there's also just these early steps. You know, if we're talking about estimating a reproduction number, it's one of those things that can sound quite simple, but actually when you go into it, there's a lot of friction points for potential users. So Anne and Anton Camacho at Epicent did some nice work last year, or maybe about 18 months ago, just for what feels like quite a simple task of taking some Ebola line list data and using EpiEstim, which is reproduction numbers based on when the cases happened, and EpiNow2, which essentially rewinds to when the infections happen and looks at transmission based on the infection times. They went through step by step and were like, where's the friction? Where are we spending time because there aren't things that are just in the right format or sort of playing nicely between packages? And so what they've done, and others have kind of got involved off the back of it, is think about what's actually quite a long bit of code for wrangling some of these steps and simplifying it down and saying, actually, it'd just be nice if we could just output it in this format to start with. It'd be nice if that next step could just take that as an input. And it'd be nice if the format coming out of Epi-Review could just be in a way that we could just define into a Epiparameter object in a single function and then plug that in for what we need next. So the first and third step of these are done. The middle one is very nearly done. And hopefully, as you can see, it's much nicer just to have 4 well-defined, well-documented functions rather than a lot of custom script that you've kind of had to write to make everything work nicely together. And this is something we've been thinking about quite a lot more broadly, of rather than just the packages themselves, how we can kind of support best practice for the ecosystem. So part of this has been developing some blueprints. So for code bases that have been developed around some of these topics, some advice and links to resources that people might want to think about in terms of everything from code clarity, how you might want to manage user contributions, how you think about good practice on sort of code review and project management. We've also been developing a lot of training resources. So colleagues at Havaiana and Unandis have been doing a lot of nice work developing tools like this Epi training kits and running some very successful online courses across different topics and everything from data science to kind of modeling concepts. We've also got a lot of these online training episodes that you can kind of see the different tutorials available. So they're there, you know, if you need to run some training or want to kind of brush up on things, all of these are open access. So hopefully there's lots of snippets within there that are useful for exploring some of these concepts. And we've also really got this increasing landscape. So not just with some of the new Epiverse tools, but broader things that people have been developing. Groups like Applied Epi, who've done a lot of nice work for that, you know, introduction to R and getting to grips with data science. And we really see a lot of these as different paths that people can be taking. Obviously, for people who want to get the detailed understanding, a lot of these are run as intensive short courses they can do and actually get kind of support from specialists. But as well, for people who just might want to brush up on a couple of the concepts or tools, a lot of the underlying resources for these are available open access as well. So you can sort of, looking at these kind of figures, start to think about the different journeys that people will have in terms of where are you in your current skills, what might you want to be developing, what are the sort of courses and open access tools out there. And I think also another thing that we thought a lot about is just the different needs people have when they're interacting. It's very easy just to say there's a bunch of tools out there, but what do you want to be doing when you're reading up on them? And there's this quite nice set of axes that's increasingly common in thinking about documentation of, is it more application people are interested in or building the theory of what something's doing? Are they looking more to learn and study, or are they really working and wanting, you know, something for practice? And so what we've got in these different axes are our training episodes, which I mentioned, the vignettes in the R packages, which just go through what the package does and what the functions do and walkthroughs and so on. You've got the references if you just want to know, I want to know what that function does, what the inputs, what the outputs. And then we've also got how-to guides, which are much more just good to go scripts. So it's just a straight code script that just gives you a specific outcome. So in this case, this is some Ebola data. And if you want to take deaths and rewind to estimate when the infections occurred based on the delays, that's what the how-to does. But I think one thing we're realizing is there's a lot of value in having these training and documentation resources that are very closely linked with the tools and the packages themselves. So it's not that you've got the kind of abstract concepts and then people have to go away and work out how to implement them. You're learning the implementations, and you've got these options to actually have a very kind of close link with how these are being used by a lot of teams in different ways. The other thing that we've done a lot of is just trying to write things down. I think this is a kind of realization that many of us had for COVID and other outbreaks. There's a lot of domain knowledge which is kind of just scattered around people's heads and quite informally shared. So trying to write down a lot of the struggles we've had, even things we're playing around with new AI tools, just trying to write that down and share that so others can think about it. Just give one example that might be interesting from a pandemic point of view that we did recently was going through a lot of the work that we did contributing to UK government advice for COVID and thinking about each task and where's the code for that task? How long would that task take to do if we had to do a rough job quickly, or if you wanted to do a very robust, you know, improved code base for it? There's some now around and things like analysis of super spreading that we've got as packages. They've got as kind of walkthrough guides. So this would take a few minutes to do now. There's other ones that would take a bit more time, but a lot of the theory is already there in our training materials. There's other ones where we've got the foundations, but we'd ideally probably want to do a bit more if this was going to be the sort of thing that would have to be regularly used in a new outbreak. And on that, some work that's been happening recently is one preprint that came out last year was around epidemiological parameters for H5N1, obviously given the current situation. And one thing that's really nice about this is the sort of task that would have taken a very long time in terms of estimation and simple scenarios. A lot of these tools, so as well as Epiparameter and Epichange, primary censored that Sam Abbott and Samuel Park and others have been working on, give very nice ways of just handling some of these common problems where you kind of have interval measured data on, like, you know, daily outcomes or something, but you've got an underlying process that it might be occurring at a finite interval that you want to account for. So here we got estimates, things like serial interval from some of the clusters, different estimates under different assumptions for what the reproduction numbers might be, and then some simple analyses for if you had some imported clusters in somewhere like UK under different transmissibility assumptions, what sort of cluster sizes would you see and what would be unusually large for a given extent of transmission. The other bit of work in progress currently is building on some of the early modeling that was done for COVID. This is work by Joel Helliwell and others in terms of thinking about all the delays and the contact tracing protocols, and then for a given set of performance and pathogen characteristics, how likely is it that you'd control an outbreak before it got, in this case, before a few hundred cases. And this was a package called Ring BP, which was quite COVID tailored. So we've been expanding that to be more general and then pulling in some of these different parameters. So particularly if we have a situation where you see some evolution, but not necessarily to very efficient transmission, you might have a longer incubation period, perhaps still with some transmission, but not a lot. And how would this trade off versus a more 2009-like virus? Another development we've obviously had since early 2020 is things like lateral flow tests, which could potentially enable much faster isolation if those can be prospectively made available. So again, adapting these models for both the new interventions and the new sort of characteristics that we might want to make available. But I think alongside also just having all of that, those code bases and those worked examples available for people to run rather than just being reported in papers. So I think that's kind of brings me to the end of the overview I wanted to give. I think one question, of course, like how to get involved in some of these efforts. I think one thing is just try things that you think might be useful. So if I've highlighted things, whether it's things we develop, other things out there in the ecosystem, I think increasingly people are very keen to hear from users of what's helpful, what will make it stronger. There's these wider collaborations like the WHO Collaboratory, particularly around things like parameters, where a lot of other groups are kind of feeding in, and there's kind of webinars and meetings, and also as these tools come out, I think an opportunity to build a really useful global resource there. There's also existing packages, things like Epireview, that have a lot of these systematic review parameters. So again, if you're working on projects where there's potential to not have to extract your own parameter, if you're working on like Lassa or Marburg or something, actually just making use of those databases that are now available. I think also just all of us could continually do more to make sure that what we're developing is as interoperable as possible with what else is out there, and also just in terms of what we're documenting, reporting. I think we see a lot of repositories go up with a README that just says, work it out for yourself, basically. And it can be massively helpful to users to have easy ways to get into it. And then we've obviously got the tools that we've been developing. So if there's things that I've said where you think, I'd love to just know if there's a bit more functionality or if something's planned, please do have a look at the GitHub, and feel free to create an issue and just point out something you think would be helpful. So with that, I'd like to thank the many, many people who've contributed to code, comments, discussions, issues in recent years, and all the people who've developed great things in the wider ecosystem. And thanks to all of you for listening. So I'll leave it there.
Thank you so much for this, Adam. Thank you so much. This was very interesting. So we open up to questions. Do you have any direct questions? Yes, we have one hand raised. Who is the first one? I think it was I see here Mikko.
Oh, sorry, I wanted to applaud, so I'm sorry for that.
Okay. We have Mikko instead.
Yeah, okay, thanks. So Mikko Kolehmainen from University of Eastern Finland. So first of all, thanks for a very nice overview, and especially about the tools. I have basically two questions. So I can understand that in the beginning of the epidemic or suspected epidemic, it's very important to get the estimate of the R values, and you showed some ways to do that. But have you considered the shortcut of using ChatGPT to get all kinds of information together and get an estimate? The second one is that after you get the idea of how big this epidemic is going to be, I think the next question quite soon is that what kind of interventions you should use to do something, which will of course interfere with the R value. And so what is your suggestion? In one of the slides you are showing some Julia-based, agent-based modeling or something like that. So is that the way to go for this intervention side?
Thanks. So yeah, both good questions. I mean, I think on the AI side, there's a lot of promising tools out there. And I think one of the things we've been doing is kind of testing where they work and where they don't work well. So one thing, for example, in the collaboratory they've been doing is AI extraction. So some of the work that Imperial has done, it's a huge amount of effort to go through and kind of screen papers, and can you do better automatically extracting those parameters? I mean, there's some of the tools, I mean, I don't know about others on this call, I think what we've looked at even on deep research and stuff, for people who work in the field, it can be quite shallow. You know, I think it struggles to do full reviews, and even things like sometimes we find it will pull, you know, it will pull out a parameter from the introduction rather than the methods, and some of these things that you wouldn't have if you're doing it systematically. But you know, if there's steps there that can be made more efficient, I think that'd be really important. I think on the code generation side, one of the things we found, to GitHub has a nice Copilot feature now, where you can, you know, essentially create a task you want to do, and it will kind of work out how to generate some code for you. But I think we find often, actually, if it's like estimating a reproduction number type task, there's a lot of nice packages that can do the estimation, but actually it's the all of the data wrangling and the nuances and the kind of context specific bits that often people spend a lot of time doing. And that's something that I think for tools like AI that are trained quite generally, I mean, if you think about our field, there's a relatively small number of things that are written down in code relative to, you know, if you want to generate some JavaScript for a website, there's a huge amount of stuff it's been trained on. So I think we find that some of the kind of domain specific error rates end up quite a lot higher for some of these things. I mean, hopefully the more we develop these kind of tools, the more you can sort of fine tune these and make these sort of things better. I think on the intervention side, as you say, I mean, I think two things that are quite important is, one is having tools that can monitor those changes. So if interventions come in, you can get that ability to nowcast, you know, how the growth rate's changing, what are those implications? Because you also get the problem of what happens to the cases reflects transmission that's happening earlier. So a lot of those tools are quite good at doing that. And I think it's also just making the suite of methods available in terms of, if you're interested in vaccine campaigns, maybe you care more about the population level estimates. If you're doing something that's very targeted, you want the individual level models. So I think we're trying to build out the things that we found useful, and a lot of our collaborators we've had a lot of questions about. But there's still, I think there's a lot more things out there that might still be gaps. So I think what we found is quite helpful is at least communicating to users the scope of what this is trying to do, and if it doesn't do that, what the alternatives are.
Thank you. We have one question in the chat and two live. Let's go for the live questions first. Francisek first.
Hello. Thanks for the very nice overview. Greetings to all of you. As we all know, the spread of the epidemics was strongly dependent on the change of the virus variants and the modification of the genetic code of the virus. Do you have also in the portfolio of the tools tools for analyzing the genetic modification of the variants, and perhaps the pace of the genetic modification of the variants, and how they are, what is their impact of the new variants of the epidemic development?
Yeah, that's a good question. I think so on the kind of phylogenetic side, I think that's something we've kind of avoided, just because there's a lot of very good tools out there that can give estimates of, you know, how those are related. Yes, I mean, even thinking of kind of next strain and some of the underlying dashboards or beast and those sort of things. One of the things we have been thinking about, and there's actually some nice, I see it links to the chat, so sort of nice Python tools from Trevor Bedford on you know, if you've got different variants co-circulating, looking at relative advantage rates, whether it's flu strains or whether it's COVID variants. So I think being able to pull those estimates together, I mean, I guess now the surveillance is different to what it was, is helpful. And then I think there's also just the scenario element that a lot of these models having that flexibility. I think this is why having some of these tools like Odin are quite useful, because if you want to just add in a new variant and add in a lot more of that structure, that's a lot easier to do now compared to what it was. But I think the thing that is often very easy to then get wrong is how you handle things like immunity. And I think the more we can kind of document what we've done for previous infections, the assumptions we've made. I mean, even things like on vaccine, if you have a 2-dose vaccine campaign, there's actually a lot of ways that you can code that incorrectly in terms of like who gets vaccinated and what happens next and what's their immune status. So I think, yeah, we're not, I think we just haven't got capacity to solve every problem, but I think hopefully getting the toolkits to a point where if this is stuff that people want to explore, it's clear the kind of the directions and the collaborations that would be useful for that.
Thanks, Joanna.
Hello, good afternoon, everybody. So, Joanna, I'm working for ACDC as a statistician. Thanks so much for the talk and for the nice overview. I was particularly interested in the pipeline when you start your presentation, and then that you mentioned about the integration of different projects and packages. So in order to allow more interoperability in the different packages that exist already, and also as a kind of some gaps were identified and limitations with COVID. So I was thinking about some practical terms and operational. So how you envision the balance between, you know, the standardization, if we think that this needs to be or intends to different countries or different agencies. So how to have this flexibility and interoperability, and again this big umbrella of packages, so that we kind of the guarantee that the things will work, and also thinking that in the different agencies or settings or countries, we will not have people with a different backgrounds that can tackle different parts. So from experience, maybe some of the statistical analysis or modeling components, they will just use packages. So how could these type of things work and, you know, guarantee a bit like the flexibility, standardization, but also like accuracy of the results? And thank you so much.
Yeah, I think that's a really big challenge. I mean, so the dashboard I showed, there's this kind of tug of war that we've had throughout, that if you have quite a kind of structured model in the back end, you can make very user-friendly dashboards, because it's very predictable for what the what's going to come in as an output and back and forth from the dashboard. And if you want the user to have a lot of flexibility in what they, how many compartments and how many different vaccine structures they have, you can either make the back end model bigger and allow more inputs, or you can let them try and edit the code, but then you get an interface which is kind of much harder to use. So what we've settled on is having libraries of models that we think cover enough of the common things that people might want to look at. So, you can incorporate different demography and different age structure and different types of campaigns and types of interventions, but you wouldn't be able to suddenly, for example, make it a completely different, you wouldn't be able to suddenly make the respiratory model a vector-borne model. That would require some additional work. But I think what we do want to do is make it so it's much, much easier for people who did want to do that to have something to build off. I think even now, a lot of our master students, for example, because we've got these nice Odin implementations in those kind of short summer projects, they can now do more complex models because they've got that kind of foundation that works in terms of stability. I think on the accuracy and the kind of maintenance side, I think that's a big challenge for all of these kind of things, of how do you ensure that tools don't just kind of fall away. So two things we think about a lot. So one is to keep the dependencies on packages quite light, so we're not like dependent on lots and lots of things that could break. And then also think about the kind of communities around these packages, that it's not like, you know, you have to use absolutely everything. And it might be particularly with health agencies, they'll have internal tools often that they don't necessarily want to switch over, but there might be, you know, you might just want to make use of some of these parameter libraries, for example, or you might want to use some of these estimation methods with your own data pipelines. But I think one of the things that we found quite helpful talking with different organizations is just internally thinking where are the bottlenecks and where does a lot of the time go that perhaps could be made more effective. And again, with some of the agencies and organizations we've talked to, where are the things where actually, if it's a relatively general tool, having it a bit more openly available so people could contribute could be quite helpful. Because then it's also a confidence thing that I think sometimes we've had tools internally, and then once you make them public and others can look at them, people will point out improvements which you wouldn't necessarily have had otherwise.
That's good. Thank you so much. Really nice.
Thanks. We have one question from Daniela in the chat. Do you have plans to translate some packages to Python, or do you keep them in R?
So we focused on R mainly because a lot, like the work Applied Epi are doing, I think in field Epi and in the field, a lot R is becoming a very common language for people to kind of learn as a starting point. So for that kind of integration, we chose R just to focus on. I think there's a danger that you try and make things in a whole bunch of languages and you just end up with a tool that isn't really finished. But I think what we're realizing is some of these issues really kind of transcend language. So there's other groups that have kind of toolkits for modeling and inference in Python. So Lancaster's one, for example. But some of the underlying issues of how do you get social mixing data in certain formats? How do you think about different inference algorithms? How do you think about how you put interventions together? That's not really a kind of code specific issue. It's something that you can generalize. So I think what we're looking much more at in a lot of our documentation for around kind of social mixing behavior is having things where even if you don't use R much, there's a lot of useful information there that you can then translate across. I think we're finding as well that, again, with support of some of these AI tools, translating between languages is increasingly not the hard bit. The hard bit is working out what you want the implementation to look like and how can you implement this estimation method reliably, or how can you make sure your data is formatted correctly. So for example, a few weeks ago, a lot of simulation models were C++ for speed, and we swapped over to Odin, which is Imperial's kind of R-based language that compiles to C. And that was actually relatively painless, with a few little things to iron out. It was a relatively painless process because we had so much documentation and we'd mapped out so clearly what all of these simulations did and what their inputs and outputs were. Actually just swapping out that bit for another language wasn't that challenging in the end. So I think what we're hoping is that if people were really, really keen to do some stuff in Python, if you look at like some of our training materials or some of our kind of walkthroughs, actually there's the little function bits you could swap out, and it could be a Python function, or it could be something else, but you still get the benefit of all of the kind of thinking that's gone into how you want to structure some of these problems.
Thank you so much. So thanks once again, Adam, and thanks to everyone for contributing to such a nice discussion. I think we can close here the session today.
Yep. Okay, well, thank you so much, and thanks for some great questions.
Yes, and have a nice day, everyone.